Today. We have very interesting topics. We'll start our afternoon session with Dr. Mohamed ElGhazaly, Paxera Health Symposium, and he'll be talking to us about AI in medical imaging.
Yes. So thank you for attending today. Hello, everyone. I am Mohamed Tarek ElGhazaly. I'm a radiologist and senior clinical application specialist for Paxera. Today, I will take you in a small journey about the AI and how the AI is supporting the radiology and the PACS, how we diagnose or how we can count on the AI and ask the AI to drive us to the best or accurate diagnosis. So first of all, we will go through two topics or main topics, how the AI is supporting the radiology at all, then how the AI we will apply it and use it in PACS. Second point is very important about how we deal with the radiology images through the PACS. So if I will use the AI, I will use it in the last point before I start my reporting. So let's figure out this together and find out how we will work with the AI or count on the AI. First of all, the image analysis, the workflow optimization, and the predictive analysis. And even if we will personalize it in some parts of the medicine, the image analysis is depending on a specific algorithms that take the image under the classification. Example for that, if I will detect some tumors or I will detect some abnormality and drives me that to best diagnosis. Okay, how we ask the AI to support us? By deep learning, okay? So the deep learning is train the AI to go through a specific topics, and I will keep feeding the AI until I get the maximum percentage of the accurate from my algorithm. Let's see this and how that will support us even through the telemedicine or teleradiology. First of all, how the AI integrates with the PACS, because I will apply the algorithms of the AI on the DICOM images that I receive it on my system, and I try to do my measurements or even my annotation to ask the AI to get my results that I already applied on the DICOM images, and I will ask him to give me its feedback. So by automated image analysis, by enhancing the quality of reporting, because as I call the AI or I give the AI a specific title, it's a clinical decision support, CDS. The clinical decision support, it's not reporting instead of you. Just give you a small hint about the accurate diagnosis, so that will save your time and increase your quality of the reporting. Example for the application or the AI applications, of course, the detect of a specific tumors or specific conditions and predictive analysis. Let's check this together. How the AI support the radiologist by ABCD. Let's take these points and try to explain it on the software and how we apply the AI on PACS. Enhance the diagnostic accuracy, time efficiency, okay, and decision support, and keep learning. And this point we will take some parts for the continuous learning and how the AI is learned from your steps in reporting and enhance the algorithms that you create or that's built it in the AI. How the AI help all the aspects. If you create a high quality report, then you will find the observing and reducing the errors and saving time and accurate diagnosis. This is your algorithm that you will get it from the AI. Let's check the start and the end algorithms together and find how the AI is applied on the PACS and we use it to judge on the clinical images. First of all, if I have an axial and coronal and sagittal plans, for example, it's in CT. Okay, So, before I was putting a marker, I will put a counting way to find the vertebra and the spine labeling, the rib detection. If I find any tumor or any lesion and I want to determine a specific part between rib number 6, for example, T11 in the vertebra, now without coronal and sagittal, if we will check the axial, you will find the AI is detecting auto spine labeling, auto rib detection by one click. Second part, how we get the organs and get the whole radiomics for this organ. Let's take an example in our Paxera Ultima AI. This is our PAX in Paxera. So I can activate the auto organ labeling. Auto organ labeling, as we see here, all the organs take a color code. And this color code, by double click, will give you the radiomics and analyze this radiomics to give you a summary for this organ. So let's take an example for a fatty liver or any abnormality in gallbladder, wherever, HCC. Once I ask the system to give me the radiomics for this organ, it will analyze the Hounsfield unit penetration and will give me the results as you see here in our AeraPod Smart chat on the right side. This is the, let's take the back door for all algorithms that we applied. Imagine that. You open our AeraPod Smart chat and stop on the image containing the abnormality and ask the AI to comment on image. In my opinion, sometimes, or some doctors or radiologists say this is a report, but this is not a report. This is a big discussion around all the abnormalities in this picture. If we look to the spine and look to the AI analysis, he take all the abnormality in the picture and give it to you by one click, because the AI is checking this image and compare it with its database and algorithms and give you, I will not say the best or 100% perfect to diagnose, but it will help you to get any missing points. You will miss it in the picture. And of course, you have the option in Paxera that you can copy this data and send it to your report directly. That will save the time and will give you the accurate diagnosis for this picture. But let's focus on one point. We need, of course, to revise this. I'm not counting on the AI 100%. Still, the radiologist is the one who teaching the AI and increase the learning curve of the AI. Third part is the patient summary. Let's take a very important point. If I have a patient coming to me with 5 or 4 prior reports, I take time to read these reports and summarize it, then I will start my diagnosis. But here by one click, or even if you make it an automated feature, the AI will read all the prior reports that you have it, or the patient have it in the patient timeline. As you see here, we have 2017, 2018, and 2025. All of these years containing all the series that this patient has performed before. So you have a prior reports. So imagine that the AI will summarize for you, as we see here on the right side, all the old and the prior reports and give you a summary and patient history to save a time for you. And give you this summary, you can copy it or use it in your new report, or even you can ask the AI, same as I explained in the last slide, you can ask the AI to comment on image. So if you ask the AI to comment on image and use the summary of the reporting, then you have a great part of your report, more than 80% from your report. Just give him an order and ask him generate report. The AI will generate for you the report and put all of this data inside your report and waiting for your verification. Last of all, AI abnormality. Let's take to the last stage. When I open the main work list page, as we see here, I find a column containing high, let me just show you this, yes, AI abnormality, containing high or low or moderate, which means before you open your study, the AI has detected the abnormality and give you and color code with the red or orange or green if this is normal or abnormal. So let's think about it. If I have 1,000 patients, I want to make a filtration. Who's normal, who's abnormal? I can do it once I open my account on the PACS. I will find this column. I can determine if I will start with the abnormal or I will start with the normal cases. That's a small part of our AI, but I only focus on the major functions that will help the radiologist to save time and get an accurate and appropriate diagnosis in his report. But last of all, again, there is some limitations in the AI. AI cannot work without my feedback, because if I choose any edit for the AI diagnosis, then the AI will learn himself and increase the learning curve. So still the AI needs the radiologist to be his eyes and his teacher or his prophet. Again, we will not asking for replacing the radiologist. The radiologist is the leader, but this is just a clinical decision support. Helps you to save time and get accurate reporting or quality of the reporting. And the limitation, of course, if you need to teach your AI, you will use the real studies. And of course, this is against the privacy or data privacy, even if we anonymize the data. But that's to help the AI to get learning curve more and more and get most accurate data. Of course, thank you for your time. I hope I gave you a small and brief data about the AI. And of course, if you have any questions, my pleasure to answer it. Thank you.